In prior videos, we went through mini-mental, when and how to use mini-mental, in field, and when we have doubt. Also, for example, if person is not suffering strokes, head traumas, I emphasized add iatrogenia, take appropriate action when that is the case, which sometimes is withdrawal bravely of blood thinners, withdrawal bravely of any sedatives, in faith that person, none of us, the same as being on wine, needs as if a physiologic fluid and any sort of medication to survive. That is especially true for any sort of psychoactive medications, but also true for some. It will come as a surprise to blood tensors or hypo or hypertensors, as well as to any sort of diabetes related drugs, most feared, and pain medication. Of course, when suffering appears or person appears to be dying, adjust, but it is actually cure that we pursue. When we pursue establishment, which part of the brain causes, for instance, tremor in the hands, neuronal aphasia, or other, many things that dysarthria, dysgraphia, all those terms that are, I assume, known to many of you. So, not being able to do what person normally is able to do, to such extent that it brings an alert, a person's brain somewhere may be bleeding. When it is worthy to pursue a differential or pictures of the brain, or even quick intervention to remove blood from such place, to prevent recrosses, remove foreign objects, or remove ischemia. When it is that, first of all, it is high on the list of probability, and second, as a requirement, pre-requirement, it is wanted and pursued by person self and nobody else. And those are two important facts. When it is also worth doing such, when it is sure, now listen to me, I cannot figure out, being a practitioner, I cannot figure out using all of my knowledge, nor can that person and all the present or available sources immediate cure, that I pursue further testing or history taking. If I have, or that person, a bleed in the occipital lobe, prefrontal or frontal, that results in speech impediment, temporary or a permanent one, or movement or dysgraphia, which means not being able to write, bizarre movements, aphasia, or a temporary or a permanent inability to paresia, or paralysis, also to move limbs, etc. When it is that, ladies and gentlemen, regardless of severity of that, there is something that I can do about it. If you, I or anyone else, if you cannot do in that very moment anything about it, then do not pursue diagnosis or tests. Or if you cannot do something, skipping those tests right now, saving time that is sure and effective. I hope that it is clear. So we've established those. Otherwise, all of the freaking notes, if you are student, resident, or fellow, or young physician, and your question about a patient arriving in a hospital is such: am I going to spend 2 hours on physical and history taking? Am I going to order CT scan or spectroscopies and other exams? Be it for free or otherwise paid, it is actually irrelevant. The answer to that question is, if results are to any of these tests combined or separated positive, what it is that I can offer to the person in question to cure or alleviate suffering, that I cannot do immediately, or I cannot do at all. And the answer is, if there is no cure, no alleviation of suffering towards cure, there's no point pursuing any studies. Example of that is, a person arrives, a person sneezes, the local salubridad or the local office of public health urges you to poke that person or do a throat swab to document a COVID-19. Person has been sneezing and has history of allergies for about 2 months, does not express concern about being sick of COVID nor increasing morbidity or mortality in a given area, being a single male living on his own right now, not currently at work, and yet the person who he visited, let's say his school teacher, insists that he's sick and he has to come and pursue screening test. Do you do screening test? And the answer to that is, what the probability is that the person's positive screening test to that person's well-being will result in cure or amelioration of symptoms, meaning, is person suffering or is person likely from 1 to 100% develop signs and symptoms of proximity to death in discomfort? If the answer is no, then for the purpose of registering cases, you don't poke persons to present data. It's illegal because it is immoral and against oath to diagnose persons for the sake of recording data for all. Yep, the same is for all of tests that are potentially long-term successfully, for example, ending in lowering of a tick in 20 years in experiments in dolly sheep in Switzerland. We don't do that because it's not ethical and therefore it makes no logical sense. That's all. Otherwise, it's iatrogenia, and all cases of such demand legal justice and remove such person first out of ignorance and then out of function if person refuses. Next, ladies and gentlemen, because it is on DSM, I will go through all of the disorders. We have established when to apply medication. Medication always, let's review it, applied when person suffers and is afraid that in time allotted to resolve that situation, the person will not be able to withstand suffering, be it pain or psychic suffering. Then you have to establish which is that video scope. If that person is sick otherwise, first, do not ever ignore a patient, one, who is deprived of basic needs, food, water, shelter in cold or shelter in heat, means of obtention of dignified income or dignified resources, including work preparation, and when person is concerned, distribution of information depending on profession. Secondly, assure that that person actually, apart from that, is not suffering from any acute illness by asking, if from head to toe, are you in any way hurting? And then make sure especially that if person is in acute pain, person obtains medical assistance. Dr. Sartori from Yugoslavia, we all thank you for your work to enable undiscriminated by prejudice medical attention to all persons rumored or accused of being drunkards, sexual harassers, predators, prostitutes or otherwise sex workers, and all of persons also with mood disorders, psychotic disorders, fear disorders, not otherwise specified, called generalized. autism disorders, and all of other nonsenses, including drug abuse, and let's add to it criminal behavior as well as hobbyish/vagabond behavior that is then used as an excuse to remove a person from pursuit of dental care, attention to acute pain like acute abdomen, acute attention in cases of any sort of trauma and accidents, including rapes, and as such source in those instances. So ask person, when person arrives, are you in acute pain? The person says, no, I am healthy, I feel healthy. Ask person, do you feel that you have fever or that you may be dying at this point of time? The person says, no, I am fine. Next, have you felt that way in the past, and delimit period of time in seek of first, always, physical, tangible, closer to death illnesses. Person as source. Do not seek such as prevention or against person's will, no matter what the booklet says anywhere in the world. If the person says, I am healthy, thank you very much, leave me alone. Even if you see a bruise, or you see whatever it is that you see, leave, and the next question, leave alone, and the next question is, are you, if you find, by the way, obtain medical attention if that is beside your area of scope, if money for fee that is possible to afford by that person, if no money for free. In emergency, we have all obligation to give assistance, having only medical or white coat in some medicine program. The program needs to be present on a list of accredited schools worldwide, or the person knowingly know that the knowledge that the person possesses is compatible or competitive. Those are the two important prerequisites. Now, if we also do not possess such, we know that any person that we know how to assist are to us delegated, and we can assist as long as the person is willing and needed an attention. If person says to not to invade privacy or intimacy, no thank you, even though I have this and that, I do not wish for any intervention, or listen to me carefully. Leave alone person's hygiene. Leave alone person's genitals, be it backwards or frontal ones. Also all the teeth, ears, and any other especially erotogenic parts. Because per law it is sexual harassment or rape to do otherwise. Especially if you selectively so, having person on street like Dr. Sojo from Houston, choose only persons who have cash and are relatively attractive, to impose showers on detentions, while majority especially of males are dirty and unable to shower or pursue employment and work. And you do so to force on those persons undressing in front of male nursing personnel or females. You are therefore to be enlisted, like Mr. Soju, as a sexual predator with a license, and as a person who cannot, unfortunately, not do that program and understand that imposition of hygiene on others equals sexual harassment when done in selective way or against will of persons involved, while non-pursuit of emancipation of persons at freedom and intimacy to choose when it is that persons wish to wash or wish not to wash and where. The same with accommodation, and the same with any screening exams for STDs. STDs, ladies and gentlemen, again, in jail you will end if you force STD testing by law worldwide, most countries. Any person, or regardless of whatever it is that you've invented, learning DSM, tested by STDs against will by you or your colleagues or whatever, is being assaulted sexually, and it is if reason for discrimination, or if done the same as pelvic exams, examination of genitals, rectal exams, and oral exams, illegal and ends in jail, not only by Dr. Sartori but by all legal systems. If persecuted or not depends on level of corruption.